Suzuki, Shem International Incorporation, Japan, for his presentation.
Okay, thank you for the introduction. Can you hear me?
Yes, we can hear you, Doctor.
Okay, so I want to make the presentation in Dubai, but however, due to other commitments, it was difficult for me to participate. So I had to make a web presentation. So now we would like to thank you for giving us the opportunity to make a presentation in spite of the different areas. And this time we talk about clinical evaluation after introduction of stem cell supernatant Biocell Shot 65 by electroporation. In Japan, cosmetics using stem cell culture medium have become popular since around 2018. And there are various types of stem cell culture media, but we are focusing our research on cord blood derived culture media, and we believe it is desirable to use different stem cell culture media for different application. And the cord blood used in this study is characterized by the fact that it does not cause excessive proliferation. You know, adipose stem cell derived culture media is well known to be superior in cell proliferation and is considered to be good for anti-aging. So this time we are conducting a beauty test to see what cord blood derived stem cell culture medium is most effective for. So first, let me briefly introduce about us. We are a company that conducts three items: research and manufacturing development and clinical evaluations. So in this research, we are verifying the effect of introducing the stem cell culture solution called Biocell Shot 65, developed by our company into the skin. So there is a clinical report about umbilical cord blood-derived stem cell treatment for patients with psoriatic arthritis, the result of which was beneficial. Margaret concluded that the stem cell is in umbilical cord blood support tissue repair and suppress over inflammation like this. So it is well known fact that the umbilical cord blood derived stem cells have some effect in the body, and cells in the body produce many cell growth factors for cell growth, cell migration, and immunosuppression. Various treatments by cell growth factors are applied in clinical and aesthetic practice based on the principle. So this is a flowchart of the producing a blood cell. So first, carefully select donors and obtain their consent for tissue donation. And after that, tissue is cleaned by specialists as soon as the baby is born and delivered to the research facility later that day. And experts extract the tissue using proprietary processing methods and frozen at minus 80 degrees Celsius. And for 2 weeks to carefully check the tissue for any infection. And only tissue that have passed the examination and are safe can be shipped. Are lifted with dry ice to the customer on the same day. And this is a key point. Reservations are required for products. And in addition, only licensed physicians and other professionals are allowed to handle products. So these steps are taken by the raw material manufacturer and we purchased from them. And so please note that we are not aware of the detailed about these procedures. So in our study, we used umbilical cord blood-derived stem cell culture supernatant, which is rich in TGF-beta. TGF-beta is involved in the wound healing process, such as inflammation, angiogenesis, and fibroblast growth, collagen synthesis and diffusion, and extracellular matrix remodeling. Also, umbilical cord blood-derived stem cell culture supernatant also contains the platelet delivered growth factor. We call it PDGF as a main ingredient, which activates many metabolic processes such as synthesis of protein and collagen and collagenase activities, migration of fibroblasts, and smooth muscle cells. Since TGF-beta and PDGA are expected to improve skin such as age spots, wrinkles, and pores, we examined the effect of cosmetic Biocell Shot 65. 65 means we used the supernatant 65%, so the name is 65. In addition to application of the culture supernatants to the skin in this study, introduction to the skin by electroporation was performed, and the results were evaluated with the facial diagnostic device during the 3 months after the start of the procedures. We use this machine. This machine name is High-Miller Professional. Biocell Shot 65 contains more than 300 growth factors like this. In contrast, the usual agents contain only a single growth factor. EGF is, for example, widely used in China as a burn medication. Biocell Shot 65 also contains EGF, of course. Single application of EGF to the skin promotes the growth of the epidermal cells and fibroblasts and the production of vascular and cellular growth factor and hepatocyte growth factor. So Biocell Shot 65 is expected to affect the skin in various ways because it contains many growth factors like this, which have beneficial effects on the skin even with a single factor. In particular, TGF-beta 1 and PDGF-AA are contains a lot, so they are expected to have a remarkable effect. TGF-beta 1 promotes production and deposition of extracellular matrix and has an anti-inflammatory effect. PDGF also acts as a modulator, and it's expected to suppress cell overgrowth and tumor development with beneficial effects to modulate other growth factors. Therefore, we introduced this solution to the patients for just 1 milliliter per application. In addition, in order to carry out the introduction more smoothly, Silamor Potele was used in combination as a solvent for Biocell Shot 65 at the same time. And pores in cell membrane open, so various substances can infiltrate into the skin cell. Suzuki proved that the hyaluronic acid of molecular weight 1 million penetrated the skin with this device. The name is Bebe Pinocchio. Therefore, the ingredients of stem cell supernatants can be introduced into skin cell with the device. But this device has a cytoplasma pass system which introduces macromolecules and unionized neutral molecules into the dermal skin without a needle. The three types of the sockets are used for body, face, and sports. And in this study, stains, wrinkles, fine lines, pores, and foveae were evaluated. Foveae is a specific facial area measured from front photo of the face. By measuring this area, the facial proportion is quantified, and it is expressed by a zone V1, where the center is the cheek, and zone V2, where the center is the side of the mouth. Their ratio determines the facial proportion. The cosmetic results were conventionally validated by impression, but FOBI is one of the markers which quantifies the cosmetic results. This is the Heimer professional. So this is about FOBI. Four aspects for assessing the degree of deterioration, improvements of face proportion. And of the four faces, the two on the upper cheek are V1, this area. And the two on the mouth to the lower cheeks are V2. Together, it is called 4V. Take a point the apex of the cheek volume, and the position is lowered due to the deterioration. On the contrary, the position goes up due to improvement. The area of V1 expands or contracts depending on the position of this point. So bulldog point of this one, so-called downward swelling that forms from the mouth to the lower part of the cheeks. If the face line collapsed due to deterioration, the position will drop like this. On the contrary, the position goes up due to the improvement. The area of V2 expands or contracts depending on the position of this point. The patients spend their daily life in the usual way without diet or sleep restrictions. Patients were extracted from the patients visiting the clinic. Since the Biocell Shot 65 used is a cosmetic product, this experiment was performed according to the guidelines established by Pure Code. The patient was selected from those who agreed to this experiment among the patients who visited the clinic and those who were healthy and had no serious illness. If abnormal reactions such as skin redness were observed during the trial, it was planned to discontinue it. So significant differences were obtained using a t-test. So these are results. This one is for patient 1. It shows the error from the ideal value set by the diagnostic machine, and smaller the value, the closer to the ideal value. So in patient 1, improvement was confirmed in wrinkle, like this, and the fine lines around the eyes, and also stains and pores after the first treatment. So we counted it five times, but no changes in 4V. Macroscopic findings confirm the improvement in dullness and wrinkle in the eyes. So this is before treatment, first treatment, there's no changing maybe. And second treatment, third treatment, fourth, fifth. So this is a patient 2. In patient 2, improvement was confirmed in fine lines along the eyes. There's no changes for V, wrinkles, stains, pores. So macroscopic findings are no change. In patient 3, no improvement was confirmed in all items. If the value is close to ideal value before the treatment, it is considered difficult to confirm the improvement. But sometimes, like second times, there is a good score. In patient 4, improvement was confirmed in wrinkles and fine lines around the eyes, and stains and pores after 5th treatment. Also, 4V is no different. So in Affiliation, improvement was confirmed in wrinkles like this, and fine lines, and stains, and pores. So faster after faster treatment. So this is the consideration. The effects of electroporation and Biocell shots on hair growth researches. Also, we are currently examining the effects of the electroporation and Biocell shot on hair growth research. And by changing the site of introduction, we believe that higher effects and different applications can be expected. We believe that by changing the side of the introduction, higher effects and different applications can be expected. This is the before treatment. First time, no. This is first time, second time, 3 times, 4 times, 5 times treatment. And since the method of treatment used in this study was to verify the effectiveness of Biocell Shot 65 only, so the effective on 4V was not confirmed. However, it has been shown in another study currently underway that the equipment we used in this study stimulate the facial expression muscles. So as future research topics, we will consider a treatment program that can also confirm the effect of FOVI, as well as development of a treatment solution, specifically designed to improve FOVI. This is a conclusion. FOVI, no change. Wrinkles, improved. Fine lines around the eyes, improved. Stains, improved. Pores, improved. This is a reason. So about 4V, no improvement was confirmed because 4V does not improve unless an approach is applied to the muscles. So reason about these items, although there are variation in the degree of improvement, the items were expected to improve due to simple application and deep introduction via population, so they were improved steadily. So in addition, application of culture supernatants to the skin, introduction to the skin by electroporation might improve stains, wrinkles, and pores. Our evaluation was performed with a facial diagnostic device during 3 months after the start of the procedure. So if you have any questions, please contact us at the following email address. Thank you very much.